So, for everyone on the phone, this is Felicia. And I first just want to say thank you to everyone for joining me today. So when we think about what we're doing here today at Online, particularly in the Contact Center, a lot of it is about regular weight loss, or regular exercise, weight loss, balanced eating habits, managing our stress. There's certainly a lot of other topics that we're expected to be able to talk about as well, but one that I think we don't get to talk about a whole lot is our digestive health. And our digestive health is very important. If our gut is not happy, then it may impact a lot of other things, including our quality of life. So today we're going to talk about one specific disorder that affects the digestive system, and that is irritable bowel syndrome, which is also known as IBS, so I'll refer to it that way as well. So this is just a reminder that if you are affiliated with any of these organizations, you'll receive continuing education credit today. Before we dive in, who has experience talking with someone about IBS? It's a lot more in this group. Okay. Anyone want to share their experiences? Good, bad, difficult, easy? Yeah.
Well, I don't know. I had one guy. It was kind of similar to my experience, but I mean, he had that, but it actually was hemorrhoids too.
Okay, so a lot of other conditions can be present in the digestive system. A lot of people that have one condition may have another or many. So my objectives today are, when you walk out of here, I'd like for you to be able to define and describe IBS, including its symptoms, how it's diagnosed, and how it's treated. Be able to explain the relationship between food and IBS, as well as be able to analyze the low FODMAP treatment option for irritable bowel syndrome. So, what is IBS? It's a functional GI disorder first. Has anyone heard of that term before? So a functional disorder means that it's not functioning as it should. According to the International Foundation for Gastrointestinal Disorders, a functional disorder is a disorder of how the gut and brain interact. The group of disorders, there's multiple other than just IBS, is classified by a relationship to motility disturbances, visceral hypersensitivity, so the gut is very sensitive, altered mucosal and immune function, altered gut microbiota, and altered central nervous system processing. So the cause for IBS is unknown, but some of those could certainly contribute to the development of IBS, as well as other functional GI disorders. But IBS specifically is characterized by a grouping of symptoms, including abdominal pain, gas, bloating, cramping, and changes in bowel movements. So there's 4 types. There's IBS-C, those with predominant constipation, IBS-D, those with predominant diarrhea, IBS-M, those with mixed bowel habits, and IBS-U, those that don't really fit into any of those categories. And as you might be thinking, it doesn't sound like something that you want to have. It affects a lot of different things and how a person can interact in their daily life, so it can certainly affect someone's quality of life. So IBS occurs without any visible signs of damage to the digestive tract. So that's very different than something like IBD, inflammatory bowel disease, which would be Crohn's and ulcerative colitis, where you're seeing chronic inflammation of the GI tract, which is also resulting in damage to the GI. It's diagnosed using the Rome criteria, and that is just as it sounds. It's just a criteria, a set of criteria. It's not a specific test, although a lot of times a gastroenterologist may rule out other diseases like IBD or celiac disease, especially if they suspect it could be IBS, they want to make sure it's not something else too. But that criteria is recurrent abdominal pain on average of at least 1 day per week during the previous 3 months, and an association with 2 or more of the following: a relationship to defecation, a change in stool frequency, and a change in the stool form or appearance. There we go. So the symptoms that I mentioned, they're really similar to many other disorders, such as inflammatory bowel disease, celiac disease, cancer, and endometriosis. So it's really important if an individual feels that they or suspects that they might have IBS, that they talk with their gastroenterologist and get an accurate diagnosis before seeking treatment. So IBS affects about 12% of individuals in North America. And that might seem small, but if you think about what we do here, I did look at some numbers from last year, and of the clients that offer health coaching, I took that number and then looked at the number of people that took a health assessment. Of those individuals, it's potentially about or over 25,000 individuals that we could potentially interact with that could be affected with IBS. That's a lot of people. So we're probably talking to them today. As far as risk factors, IBS is more prevalent in females than men. It can occur at any age, but it is more likely to develop in individuals under 50. A family history can certainly be a risk factor if there's someone else in the family that has it. I find this one to be really interesting, having a history of stressful or difficult life events. So stress certainly is real. I see like nodding his head back there. Or a severe infection in the digestive tract. So, you guys all saw that I had my chocolate ice cream or my poop emoji up here. Thank you, Heather, for letting me borrow this. We're going to talk a little bit about this. This is the Bristol Stool Form Scale, and it's a validated instrument to assess stool appearance. It can be used to determine those subtypes. So the individuals with the IBS-C are going to more often have those hard lumpy stools in the type 1 and type 2. Individuals with IBS-D, they're more often going to have type 6 or type 7, that loose watery stool. And then you can see the middle section is where we'd like to see it for that normal consistency. Talking about this subject can be uncomfortable. I know that it is. But imagine how uncomfortable someone might feel if they're experiencing this, to actually speak up and say it. So I bring this up just to help normalize the conversation so that you might feel a little bit more comfortable talking about diarrhea, constipation, and everything in between. Hard, lumpy stools, watery, loose stools. I'm sure each and every one of us has experienced all 7 of these types at least once in their lifetime. So there's a variety of treatment options that can be used for IBS, and these are in no particular order, but the low FODMAP diet, increased fiber, avoidance of gluten, medications, probiotics, mental health therapies, and lifestyle changes. So I find it very interesting, just like I did with the risk factors, but mental health therapies. So things like cognitive behavioral therapy, hypnotherapy, multi-component psychotherapy, and dynamic psychotherapy are all used in treatment, which is really interesting. And in terms of lifestyle changes, those are a lot of things that we talked about today. Exercise. If someone is constipated and they're not active, get them moving. That can help stimulate the digestive tract. Reducing stress. We talk about stress management every day. And getting enough sleep. which may be something that we don't talk about as often, but that certainly can be a factor that we can talk to individuals about, and it's right there on our health assessment too. So this is from, it's a summary of therapies for irritable bowel syndrome from a review from the American Medical Association. And the low FODMAP diet is not on this slide particularly, but they did talk about it in this article. But it just goes over the different treatment options, the quality of evidence that's there for that treatment, how it can benefit an individual with IBS. Some of them you'll see specifically say for IBS-C or IBS-D, those for diarrhea or constipation, and how it could affect, what are the adverse effects of that treatment option. So all of them have something pretty much. So there's medications that can help with IBS-C, those with constipation, and some of those adverse events could include diarrhea. That's not really something that we want, but potentially could happen. Fiber, you'll see it's more beneficial for individuals with IBS-C, but it still could cause things like bloating, cramping, and diarrhea. So there's a little bit of a risk with all of these, but there's certainly a lot of options for an individual with IBS. And this slide is from an article from the American College of Gastroenterology showing the advantages and disadvantages of dietary restriction for IBS, so including lactose and gluten restriction, spicy food restriction, soluble fiber, and then the low FODMAP diet. I'll specifically point out gluten, kind of talk about that later too, but gluten can be a contributor for some individuals that have IBS. But one of the disadvantages of being on a gluten-free diet is that it may not necessarily be the gluten, which is the protein found in meat products or and other grains as well. It could potentially be the fructans. So that is something that we'll talk about. But that is just one of the talking points there that it may not be as specific as the low FODMAP diet. Oh, actually, I didn't want to talk about this too first. Sorry, let's slide too fast. Yeah. And where I want to be, sorry. So in terms of what we have in our coaching supplement and what's recommended there, I don't know, has anyone looked at that recently for IBS? So there we're recommending avoiding problem foods such as spicy or fatty foods, alcohol, carbonated or caffeinated beverages, artificial sweeteners that contain sugar alcohols. We also recommend getting enough fiber, drinking plenty of fluids, eating small frequent meals, chewing your food thoroughly. So those are not bad recommendations. Those are all still great things to recommend, but they're a little different than some of these that are talked about here. So before today, has anyone ever heard of the low FODMAP diet? Okay. So some, but not everyone. Has anyone never heard of it in their entire life? So a lot of people in the room never heard of it. Yeah. So we're going to talk about what it is. But essentially, it's a therapeutic diet treatment used to improve IBS symptoms. And in a meta-analysis published in 2017, the traditional IBS diet, which is some of those things that I mentioned before, avoidance of caffeine and carbonated beverages, high-fat, spicy foods, was compared with the low FODMAP diet. Both of them proved to be effective in the management of symptoms, but the low FODMAP diet showed a greater improvement in IBS symptom severity scores, and the symptom severity scores measured abdominal pain severity, pain frequency, bloating, bowel habit dissatisfaction, as well as interference with quality of life. And I really like that that piece was evaluated as well. So here are your FODMAPs. FODMAP is an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And they each have some subcategories that we'll go into. But FODMAPs are a collection of short-chain carbohydrates that are not absorbed properly in the gut. They can trigger symptoms for people with IBS, and they're naturally found in many foods and food additives. So we're going to dive into each of these, lactose, fructose, polyols, fructans, and GOS, but these FODMAPs have been pointed out as possible culprits since 1965, but it wasn't until 2004 when Monash University out of Australia coined the term FODMAP and really brought it all together into a collective diet. But we're just going to dive in. So oligosaccharides. So that is the first of the FODMAP groups. It is the largest of them as well in terms of its structure. Its subgroups are the lacto-oligosaccharides, also referred to as GOS, and fructans. Some examples of foods that GOS are found in are legumes and nuts. And some examples of foods you can find fructans are wheat, onions, and garlic. Something interesting about these is that there's no human enzyme available to break these down, so they're actually malabsorbed in everyone. They're highly fermentable and gas-producing in the gut, and they're possible contributors to abdominal pain, bloating, and flatulence. So if you think of things like legumes, beans, some of those side effects, like gas, they are natural, and it's okay to have those things. Doesn't mean you have IBS. But for individuals who have IBS, their digestive system, their GI tract is so sensitive that they're experiencing other things too, especially pain. So the next one is disaccharides, and our FODMAP disaccharide is lactose. So you might know of lactose. It's found in dairy products like milk and yogurt. Lactose, you see here, is broken down by lactase. That's the enzyme that our body produces to break it down into galactose and glucose. But if an individual is lactose intolerant, they don't produce enough lactase, they're not going to be able to break down this disaccharide the way it's supposed to be. And in the body, when that happens, water is drawn into the gut, and this FODMAP is fermented, which contributes to gas, bloating, as well as pain. There is also a breath test, a hydrogen methane breath test that can be performed to assess lactose intolerance. Someone in the last group asked how expensive that was, and I'm not sure. So I don't know if anyone in here happens to know, but certainly a factor to consider in that. So our monosaccharide FODMAP is fructose. And fructose is naturally found in apples, pears, honey. It's also present in high fructose corn syrup. Fructose is the smallest unit of the FODMAPs. And when we talk about fructose as a FODMAP, we're specifically talking about fructose in excess of glucose. So it's easier to absorb fructose when glucose is present, but when there's extra fructose, then it may be malabsorbed. And because it's so small, it has an osmotic effect in the gut, so it draws water in, resulting in pain, bloating, diarrhea, and potentially altered motility as well. Fructose malabsorption can also be detected through a breath test, but research suggests that symptoms might occur independently from being malabsorbed, so that breath test isn't necessarily reliable when we're talking about FODMAPs. And I will show you more examples a little bit later of high and low FODMAP foods, but this molecule here is sucrose, so that's table sugar, and sucrose is glucose plus fructose. So this one, glucose and fructose are present in equal amounts. There is not excess glucose, so it is not considered a FODMAP in this scenario, or a high FODMAP food. It would be a low FODMAP food. So lastly is polyols, and that is most commonly mannitol and sorbitol, which is present in some fruits and vegetables like apples, cauliflower, and mushrooms. Polyols are slowly absorbed in the small intestine, and they also have an osmotic effect. And you'll also find polyols as food additives, sugar alcohols, as a replacement for sugar. So that's what those other polyols are: isomalt, maltitol, lactitol, and xylitol. So they're frequently used in products like sugar-free mint, sugar-free gum, sugar-free candy. So for a lot of sugar alcohols don't have the same effect in our body. Sorry, let me grab a sip of water. Doesn't have the same effect on our blood sugar as sugar does. So that's why you'll frequently see it in those foods. But many individuals could see, if they're sensitive to these foods, they're going to see a laxative effect. And this is an example of sugar-free Reese's Cups. This is the label. And it comes with a nice label, warning sign that says individuals sensitive to sugar substitutes may experience a laxative effect. So someone with IBS, especially, it's not going to feel great. They're going to be much more sensitive to these foods if it's a trigger for them. Yes, you have a question?
Does chili cow fall underneath the polyols
We'll have
category?
to look at that label.
Also, was xylitol, was that the one that they were putting in chips? Were they able to put the warning label on it, or was it like may cause?
No, that was Olestra.
Yeah.
Olestra, okay.
So that was something different. But down here.
Is that a required label for the laxative effect? Yeah.
I don't know.
And sugar-free
Is
stuff
it?
it is, yeah.
Okay.
Yeah.
I was really trying to get, there's a great label on sugar-free Jelly Bellies, and it said something to the effect of they recommend only eating 8 at a time as a starting point, I guess, to ensure you're not having a laxative effect from those.
Well, you know, those sugar-free mints we had laying around everywhere. I kept warning people not to eat a lot of that.
Don't eat the
because
whole
they
potato.
have sugar alcohol in them.
That explains a lot.
So a little quiz, true or false? Based on what you know right now, what do you think? The low FODMAP diet is a forever diet. True or false?
Depends on the individual.
Okay.
That was the question, right?
I'm gonna say false.
False.
Depends on the individual. False.
Richard is sticking with his answer. So the answer is false. And we're going to talk about why. So the low FODMAP diet is a 3-part diet. And the title of the low FODMAP diet is a little misleading in itself, but the low FODMAP portion is really only in phase 1. After phase 1, or where you're removing high FODMAP foods, you move on to phase 2, where you're challenging foods that are high in FODMAPs to assess tolerance. And then in 3, based on your findings in phase 2, you're personalizing your diet. So it's more of a modified FODMAP diet where you are bringing back high FODMAP foods and broadening the diet. But the goals here are to have symptom control as well as the most varied and diverse diet as possible. So I want to show you some of the high and low FODMAP foods. So we're going to look at these. I also have them printed if you want to look after we're done. So this is not, it's a pretty complete list, but it's not necessarily every single FODMAP that's out there. All right, I'm trying to get it for you guys. All right, so there's some in pretty much almost every food group. So there's lots of fruits that contain FODMAPs. There's lots of nuts and grains that contain FODMAPs. Some of them contain more than one type, like apricots contain fructans and polyols. cherries, fructose, and polyols. Some of them only have one. Canned fruit and natural juice only has one. I think that was fructose up at the top. Lots of vegetables also contain FODMAPs. A lot of these are high in fructans. A few beverages like chamomile tea is on here. You'll see here all of those sugar alcohols that I mentioned, as well as some other. These are all pretty much used as sweeteners. I mentioned erythritol in the last group, so I'll mention that here too. So this one has a little star by it, so we'll talk about that too and why that's there. But there's a lot of foods. It's a pretty long list of foods that are high in FODMAPs. So in that first phase, these are the foods that you would not be eating. So look at the low FODMAP list. So again, it's still a pretty big list of foods, and this isn't necessarily every single food, but a lot of them. There's still a lot of fruits that can be eaten in that phase one, a lot of vegetables. You'll see there's some numbers, and I think they were on the other page too, of the legumes. Like chickpeas, if you eat a quarter cup or less, that would be considered a low FODMAP food, but if you ate more than that, it would then be considered a high FODMAP food. Your proteins are not included there because when we're talking about FODMAPs, we're talking about short chain carbohydrates. We're not talking about proteins. Gluten-free grains are up there, or breads and cereals, millet, quinoa. A lot of these are probably foods that you eat now. But for someone that doesn't eat those, that can be a pretty big transition. There's lactose-free dairy products. There's also things like cheese. It's not a lactose-free stage in that first one, but it is ones that are low in lactose. Or let's see, coffee is on here, which I had mentioned coffee in the in that traditional diet, or what we recommend here, or things like caffeine beverages. So it's not considered a FODMAP, although it may it can irritate the GI tract for people with IBS because they are so sensitive. So it's still something to consider, but it's not considered a FODMAP food, so it's perfectly acceptable in that phase one. And a lot of sugars. That cane sugar, like I mentioned, is fine on the first phase. And someone had asked about artificial sweeteners like aspartame. They really like crystallite, and those are still considered low FODMAP foods or ingredients. And again, I do have these printed out if you want to look at these after. But, oh, I forgot to show you, on the low FODMAP list, erythritol is also listed there with a star as well. Erythritol is a sugar alcohol. It's well absorbed in the body. It's not metabolized though, and it's actually hard for our gut bacteria to break it down. It's unlikely to have that laxative effect like the other polyols, but it may impact fructose absorption. So it's not definitive, but some individuals would recommend eliminating it while in that phase one of the diet. So that one's kind of on the fence. Oh, it's your question.
What kind of things contain that? I mean, what would you see
Erythritol?
that? Yeah.
Chili cow. That was my,
Is it erythritol?
yeah, I looked it up. It's got erythritol
So
in it.
that's,
What is chili cow?
It's the worst ice cream ever.
Have you seen like Halo's have ice cream?
I seem like
Yeah.
skinny cow, but not.
It's not that one. It's just an ice cream that it doesn't have any sugar. Is that right?
I think we're
very
a
low.
lot of kind of ice cream that didn't have any kind of
It's just low calorie. It's like
Okay, it's a
for
low
a pint.
calorie.
Half pint.
And this is our sweeteners, I think.
Yeah.
This is our erythritol.
So there's different sweeteners. Dorothy really likes to bake with it, so she uses it for home use. But it's I feel like I see it more in the more expensive sugar-free products. And if you try to buy it, it's more expensive than some of the others.
And it's also mixed with like stevia if you're buying
A lot of times it's mixed. I think it's
stevia, monk
mixed
fruit,
with monk fruit, yeah.
more of that bulk.
Good, monk fruit.
I just stay away from all that.
So,
Hey, Felicia,
yes.
do you recommend a person with severe IBS get on an airplane?
That made me laugh. You're-
Well, I had a member that got on the airplane, and he was messed up.
That's
I'm
something
sorry.
that, again, it really affects their quality of life. Like they're worried about traveling, they're worried about going to work, standing up here and doing a presentation. What if I have to go to the bathroom? Like it can affect so many things.
I mean, how would it affect, I mean, was he scared he was gonna put himself on a plane or?
Well, I guess the biometric pressure, it put so much pressure on him, so he was really messed up, yeah.
I hadn't considered
Yeah.
that.
Yeah, and they find also, I know, I worked with a coworker that had IBS pretty bad, and she said because they're so irritated all the time, it's like their sphincter doesn't work properly. So when they've gotta go, they've gotta go. So if he's on an airplane and the seatbelt light's on, take off,
What do you do?
landing,
You
there's
have to wear a
nothing
diaper
you
on
can
the
do.
plane,
Yeah.
like that. That's
Yeah.
challenging. I mean, it sounds funny, but not if it affects you.
Right.
More people.
So the phase 1 of the low FODMAP diet, so it's 2 to 6 weeks of low FODMAP foods. You're eliminating those high FODMAP foods that I
It's a
mentioned.
conversation.
Research does suggest that staying on the phase 1 of the low FODMAP diet greater than 6 weeks could have health implications. Specifically, a few different reasons. It could be nutritionally inadequate, but it could also disrupt our gut microbiome. So we're eliminating a lot of those foods that do contain prebiotics, which are basically food for our gut. So if we're not having that, then we're potentially disrupting what's going on in there. And we want to have positive effects, not negative ones. I also want to share that this plan really should be followed under the direction of a registered dietitian, one that has experience in GI disorders as well as experience with the low FODMAP diet because it's so complicated. So individuals following this portion of the plan, they'll assess their symptoms. They can use a rating scale. They may also use that Bristol stool scale that I showed you earlier with that different types from 1 to 7 of our stool. And if an individual within that time period, 2 to 6 weeks, if they have improved symptoms, they can move on to the next phase. But if they don't have symptom relief, then they should discontinue the diet and try another form of treatment. But it has shown, this phase has shown to improve up to 75% of patients within 6 weeks. Some reasons that it may not work, it may be that there's another intolerance to food that's not in this plan, not one of the FODMAPs. It might be something that's not diet related at all. It could be due to lack of compliance. This is a really hard plan. Or it could be maybe they accidentally ate FODMAP foods and just didn't realize it. Yes.
So you said that research has shown it helps up to 75% of the people. I'm wondering, has that research been carried out on what they were able to add back in, what the majority were able to add back in?
Great question. Yeah, on the next slide. I'll get there.
Okay.
So phase 2. If a person does well in phase 1, they'll transition to phase 2. That typically lasts about 6 to 8 weeks. And during this phase, an individual will stay on the low FODMAP plan, but they'll systematically reintroduce high FODMAP foods one at a time. At that time, they're assessing tolerance and triggers. So is it causing symptoms? And if it's not, is there a tolerance point where they eventually do have symptoms? They're also assessing foods that are not triggers, that when we move on to the next phase, we can broaden the diet. So before I touch on that, I will say, or what's on the slide, that there is limited research available for this portion of the diet. And these are just some examples of challenge foods, but really protocols are based on clinical experience. And we do need more research in this area to develop more specific protocols. So, does that answer your question? Okay. But these are some examples of foods that can be challenged for each of the different FODMAPs. So you're challenging fructose on its own, lactose on its own, sorbitol and mannitol each individually, GOS on its own. Fructans are usually broken out into 3 different challenges between usually wheat, onion, and garlic. Onion and garlic are present in a lot of foods that you'll purchase, recipes, if you're going out to eat. So you want to know if you're having an issue with these foods. But each food is challenged one at a time while remaining on the low FODMAP diet. It's typically performed over 3 days. During each of those challenges, an individual would write down their symptoms, monitor them, and if they experience a significant increase in symptoms, then that would mean they failed the challenge and they're advised to discontinue that FODMAP group. They would then wait a couple of days before they begin the next challenge. If they don't experience symptoms, they would then, on day 1, let's say, they would then increase their portion to their preferred serving size. So for example, on day 1, I could have included with foods that I'm eating half a clove of garlic. Day 2, 1 clove of garlic. Day 3, 1.5 cloves of garlic. Or with mushrooms, I could do a half a cup of raw mushrooms on day 1, 1 cup of raw mushrooms on day 2, 1.5 cups on day 3. And those can be cooked as well, but they're usually measured out raw. After each group is challenged and established, individuals are encouraged to assess their tolerance to larger doses and increased frequency. And you may be eating garlic more than 1 time a day, not just in 1 meal on your day. As well as challenge combinations of high FODMAP foods. I mentioned pears and apples. They have more than 1 FODMAP in them, even though they're just 1 piece of fruit. And we don't typically just eat, let's say, honey on its own. We might have that with some bread and something else that's on it. So putting things together to see how someone tolerates that. So the last phase is the personalization phase. So at this point, we're getting to more of a modified FODMAP diet, not just a low FODMAP diet. And again, it's important to encourage someone to work with a dietitian that's experienced with the low FODMAP diet plan to ensure balance and nutritional adequacy. It's also important to remember that not all individuals have success with this diet, and not all individuals have success with diet alone. So they may need multiple forms of treatment to reduce their symptoms. So another question, true or false, the low FODMAP diet is a gluten-free diet?
Yes. Sure.
That one true. I think I heard a false.
I say false.
Got a
I don't
false.
think it's a pure gluten-free diet.
Well, Richard, you are
Two.
correct. That is false.
It's Tom Brady of IBS questions.
Well, I was just thinking about, just think if they have a chronic problem. I mean, they could be diagnosed with diverticulitis, or, you know, their doctor trying to figure out what's their problem, and it could end up being IBS, or it could end up being diverticulitis, or it could be Crohn's disease.
And with those, there are other things that they can see inside the gut to be able to make that diagnosis, whereas IBS, you're just looking at symptoms.
Okay, good.
That criteria to be able to diagnose it. So a lot of times they are excluding other things as they're getting to that diagnosis too. But the low FODMAP diet is not a gluten-free diet. I mentioned earlier, so gluten is a protein found in wheat and other grains. And the FODMAP in wheat and other grains is fructan. But this is just important to know. So the diet isn't completely gluten-free. It is low in gluten though. If someone does need to be on a gluten-free diet, they would need to be on a gluten-free diet, not necessarily this diet. But if someone let's say, has undiagnosed celiac disease and they think they have IBS, and so they try out this diet, that may then delay their diagnosis. They may not be able to get an accurate diagnosis of celiac disease. You do need to have gluten present in the diet to be able to get a good diagnosis. But it's also continuing to damage the intestine. So someone with celiac disease is having inflammation, damage to their intestines, and so we want someone to get the right diagnosis so that they can get the right treatment. So a couple of takeaways. Again, an accurate diagnosis of IBS is important. Phase 1 of the low FODMAP diet is not a lifetime diet. We want them to transition to phase 2 and then phase 3. Greater than 6 weeks of phase 1 of the low FODMAP diet could impact our gut bacteria negatively. The low FODMAP diet is not a gluten-free diet. I think I didn't mention this earlier, but failed challenges can actually be repeated later on. So symptoms of IBS change, and so can your tolerance. So if someone successfully gets to that modified low FODMAP portion and they failed a few challenges, they can actually challenge again a couple months later to see if anything has changed. This plan is challenging and strict, so it's really important that they're working with someone that's experienced not only in digestive health, but this diet plan. An RD specifically can certainly help make sure there's nutritional adequacy. They can take other diagnoses into consideration. Other things that would need to be considered are food preferences, cooking skill level, or maybe limitations that someone might have. And because it's so strict, it is not recommended for individuals with an eating disorder or those that are malnourished or at risk for being malnourished. And not all individuals will have relief with diet alone. So how does this translate to what we do here? So I would encourage you to use some of the takeaways as talking points when you're working with individuals. We don't necessarily prescribe diets here, but if you hear someone saying that they're doing the low FODMAP diet and they have not been diagnosed, they just think they might have IBS, encourage them to go talk to their doctor, get a proper diagnosis. If they're in phase 1 and they have symptom relief and they don't want to transition to phase 2, talk to them about that. Let them know it may not be nutritionally adequate, maybe disrupting their microbiome. And those are things that we don't want to see. But an individual with IBS, if they get to the point where they have symptom control, they may be scared, essentially, to bring foods back into their plan. They don't want to have those symptoms again. Encourage members to seek support from an RD as well as their gastroenterologist. And do the things that we're doing today. Encourage fiber-rich foods, exercise, stress management, and sleep. So, what questions do you have?
I want to ask you, what do you think about eating a lot of grilled food from the grill? I actually thought that was very healthy, but I was hearing other things about that.
Well, I was going to probably a little off topic from IBS, but cooking foods at high heat can certainly, maybe someone in the audience can help me. Is it acrylamides? I'm close to the word, but I don't think that's the word.
I know what you're talking about, but I can't.
So when foods are cooked to a really high temperature like that, or cooked at a really high temperature, a component can form, and I want to say that's the name of it, but I might have to look it up. But that is a known carcinogen.
So if you grill, don't burn your meat.
I thought sometimes it can affect people with arthritis too. So they say the best thing to do is bake, broil up the foods versus that.
I'm not aware of that, but
Okay.
potentially.
Yeah, I heard usually when grilling.
I just wonder, when you refer someone to talk to their doctor, how many doctors are actually familiar with what someone needs to do when they have IBS, because I personally had an experience with, it wasn't my doctor, but it was a nurse practitioner who suspected that I had IBS, and he said, if it basically what it boils down to is don't eat gluten, and if it tastes good, spit it out. And I'm sitting there as a dietitian thinking, oh, I wish that you wouldn't say that. I wish that you would get education before you said that.
Right, and I think we're seeing it more and more as more of a frontline treatment. It's on big websites. It's not, I didn't have to dig around to find all this information. And when I was looking at things, I actually saw that in the February issue of a journal for American College of Gastroenterology. They had 2 articles on FODMAP. So it's there. It's just, are they reading it? Are they learning it?
Right.
I'm not sure, but that's where RDs can make a great partnership
Right.
with those individuals.
I didn't ever get a chance to talk to my physician about that. I was going to, but that guy's not there anymore. I presume that's why.
Yeah, and I wonder if there's a difference between the recommendation from a general practitioner or a nurse practitioner and a gastroenterologist.
Oh, I'm sure.
I do have some resources up here, just with some info on the low fat nut diet if you want to look at it. Also, those lists are there. The Monash University does have an app that has FODMAPs in them. It's really, really nice, but it's not a free app, so I hate to ever recommend that to anyone. But I actually have it, so if you want to look at it, I'm happy to show you. But it has a really great list of foods all across the world, which is really nice, and it breaks things down pretty simply, and it's constantly updated, which is nice to know too.
It might be a dumb question, but I was just thinking about a lot of our furry friends, like our dogs, so we gotta kind of watch what you feed them too. They probably could have something simple.
You know, I don't know if Mitch would like me to share this, but he told me his dog has IBS.
Okay. Wow.
Is that
They can get just as many human issues.
I know, yeah. I mean, dogs have diabetes. They get cancer.
Right.
Lots of things.
Right.
Blake, what did you think about the mental health piece of it? I didn't get to talk a lot about it, but.
I just was thinking, I talked to so many people, I'm not gonna name any names, but Dollar General, who I think probably have a slew of health conditions that are at least exacerbated by being so stressed out all the time. I can just imagine that if you're trying to get something like IBS under control, I mean, even if you do all the dietary things, just the amount of stress has gotta be.
Right. It may not be enough, just as on its own.
I wonder how many people, though, give up before they get the final diagnosis. Because I know we went through that with our daughter. We thought she had IBS, and you just first quack she went to, or just threw medication at her. And then the other one, the next one we took her to said, well, you just need to control it with diet, which failed. And it was a constant battle. Got gastrologist, all of these different things, and finally she said it's not worth me to finally get a diagnosis. It's too expensive, because she felt like she kept going in a circle.
Right.
And so it makes me wonder how many people give up before they get that final diagnosis.
I can't imagine how challenging it must be. Right. And then even once they get the diagnosis, to find a treatment option that works for them.
Did you all find a treatment option that's working?
No, she still deals with a lot of bloating. She still deals with a lot of gas. She still deals with diarrhea. She just has learned to live with it. And it's sad, which she's anxious all the time. Oh my gosh, she's so high strung. But, and that could be the fact that it's a constant thing with hers, because she's constantly under stress.
Right.
I was having an issue one time, and I was thinking it was my colon or something. So I went to the doctor, and come to find out it was actually hemorrhoids. I probably shouldn't even tell y'all. I just get it off my okay.
That does not have to do with IBS, Richard.
Okay, I know I know.
IBS.
I'm sorry.
That's Felicia's next presentation.
And all about just for you.
I remember. I'm sorry.
Felicia, did you read much about the curcumin supplements?
I did not research that, but I do know that that is
Okay, I'm sorry.
Pretty sure.
Have you heard about the EPI though, that they're like talking about now?
I don't know what you're talking about.
EPI is similar to IBS, and there's a lot of things like find, search.
Oh, boy, I love to look
I
at
probably don't know if you said it, because now that you're saying it, I think is it EIP maybe, or the EPI?
No, it's EPI, exocrine pancreatic insufficiency.
Okay.
But yeah, there's been a lot of, I listen to talk radio in the morning, and that's a lot of the commercials that they're running now.
Mhm.
It's basically, if you think you have IBS, look into EPI as well.
Interesting.
Or
And
if you haven't been diagnosed with IBS, but you have those symptoms, look into the EPI as well.
yeah, and you would hope that a gastroenterologist would, but I mean, again, are they getting to that point? Because it is expensive to go see a specialist, especially when they don't have an answer for you. All right, well, thank you, everyone.
This is a
And feel free to
serious,
look
this
at
is a
any of these
serious
if you want.
thing too.